Hi, this is Jamie Diaz with Barks to Basics. I'm so excited today. I have Dr. Man from Boca Midtown Animal Hospital, and we're going to get into this. Thank you for joining us. He's not just a vet. He's done some pretty special things that we're going to talk about, but thank you for being here in your crazy day. So let's start with, this is like so unique, first of all. So let's first talk about breed-specific things. So Dr. Man here has developed or perfected, or what would you say you've done with this laser treatment?
Improved
on it. So I have to tell you, I have never gotten, and I always wanted to, I don't think I do now, but I always wanted to get a pug and a Frenchie and possibly a bulldog. And the main reason I didn't want, well, there's a lot of reasons now that I know dogs, that I didn't want to get them. One of the main things was their breathing was like so annoying for me as an owner. I'm sure super annoying for them as well. But before we jump into like all of that, I think you've probably seen as a veterinarian, what is this Frenchie kind of thing now? Like, everybody all of a sudden had Frenchies. Even in my training schools, I see them. What do you think this craze was or is now with these Frenchies?
Well, if you look at the world and pet parents and pet lovers, everybody loves an intelligent dog, a dog that can bond with you, a dog that understands you. Also, on the same token, they want a dog that they can have in their house where they don't have to have a huge yard. They don't have to have, a large space for the dog to be able to exercise. So we have a personality of a bulldog who, they're friendly, they're, great companions, they're intelligent, they're responsive. Sloppy, yes, but they don't require as much space as the larger breed dogs. And, because of all those things and their cuteness and actually, one of the biggest thing is that when a woman or a man or anyone who loves babies sees a French bulldog puppy, the first thing they think of is a baby because they see that big head, they see those big eyes, and that's what draws those pheromones to us being in love with babies. Oh, they're so cute. Look at that face. They remind us of infants, and it's actually been studied to be truth.
Wow, that is so true. First of all, I've never heard that. And it totally makes sense. And it's true. And when they're like babies, it's like these little things, I know a lot of my clients now with Frenchies. I'm not sure about how the breeding's been going because some have more behavior issues now. But let's get to really what's important is I went to meet you at your veterinarian office. Again, Boca Midtown Animal Hospital, which is an amazing facility we're going to get to in the next segment. But you told me for these breathing issues with dogs, the top three, Frenchie, is this the right order? Frenchie, Bulldog, Pug?
Yes, Frenchie, English Bulldog, and Pug.
Okay. So can you explain a little bit? I just thought, first of all, I didn't even know there was a procedure. I just thought that the breathing, that's just how they breathe. That there's nothing you can do about it. They're going to snore. They're going to do all these things. And after speaking with you, I realize it's like much more than that. So can you go into a little bit? Because I know there's so many people out there that have these breeds and maybe even felt like me, but kind of what is happening when they are breathing like that? Is it bad for their health or is it just like an annoying noise for us?
Yeah, your comment was perceptive and exactly why it's so important to the veterinary community and veterinarians like me to discuss that, hey, yes, you were told that it's normal for that dog to snore because of the breed. And unfortunately, that is not correct. And we have, unfortunately, bred what's called an extreme brachycephalic dog breed, which means they're not only, flatter and shorter noses, but they're extremely flat and extremely short, which really puts them at a disability to breathe, a disadvantage to thrive. And it's a sign of an active upper airway obstruction. So it's not a joke. These dogs are not getting oxygen. And imagine,
hold your nose like this for 30 seconds and just try to breathe like that and then see how it feels.
And then try to breathe through a straw in your throat. So that's what these dogs are suffering from.
Wow.
And it has to be evaluated and intervene early. That's important because it's an animal welfare issue. So that's why it's so important. That's why it's become such a passion for me to make sure that we bring it to everyone's attention.
So I come in 8-week-old Frenchie puppy. Can you tell right away, first of all, in this breed, does every single dog have this issue, or you will see some Frenchies that don't? I mean, can it be improved in the breed with every single Frenchie that you see, or it's selective to some?
That's a great question. And no, not every French Bulldog requires intervention. And there's actually specific measurements that are made from the muzzle and the head to give you measurements to tell you, okay, is this dog likely going to have a problem? The nose is the easiest thing to see, the size of the nostrils and the actual entrance to the nose. With time, as they go up from 8 weeks, their first puppy check, to 6 months, things change and actually even worsen in a short time, because they have what's called negative airway pressure because of those narrowed airways in the nose and the throat. And that creates swelling of tissues. That's soft tissue in the nose, that's soft tissue in the throat, and things react even inside, just like with us, the tonsils. Everything just starts to become larger, more irritated and ulcerated. So with time, the nose actually starts to look smaller and smaller. And I hear that from pet parents. When he was a real young puppy, I didn't notice that as much. But now it's like, where has his nose gone? It's like completely gone. There's no entrance.
That's crazy. I'd always tell bulldog owners, don't walk your dog long. Like, they can't breathe. And we're in Florida, obviously, so it's worse with the heat. I never thought there's like more of an issue here than just that you got to deal with it. You got a Frenchie. They have to deal with that. So I'm 8 weeks old. You might be able to see a little bit, meaning the Frenchie. I bring in the puppy to you. At what age? Is it 6 months or something? When will you suggest, obviously, if you see it's really bad, but when do you suggest, would you suggest 6 months, 10 weeks, like that, which we're going to go over the procedure, that you're going to say to me, I really think we can make a change in this dog's life? Like, how young would you suggest this procedure?
Great question. So I'll answer it in two parts. The first part you made was a great comment. At 8 weeks, we can see some signs of it. When we have a French Bulldog who's high at risk for, that and other medical issues, as veterinarians, it's our responsibility to let these pet parents know that these breeders actually are able to enable health coverage from the time these puppies are born now. Many, if not a majority, of these pet health insurance companies offer these trial programs to the breeders to get them enrolled in insurance. Because the problem is people wait. They get the puppy, then they have a waiting period for the puppy for any kind of injury or illness to be covered. And then what happens, unfortunately, is it becomes pre-existing. So I would say being proactive is great, but having health insurance for the dog is so important and critical. And ask your breeder, can I get a trial health insurance? Can I get them enrolled just to make sure I'm covered? And they should be actually on board with that because they want to help too. And it takes the onus off of them. So why not? Let's first start before they even get to the vet. Make sure they've already gotten enrolled in a health insurance program. And the answer to the second question is normally we don't correct these issues until they're developed enough. So the skull and soft tissues at around 6 months of age should be developed enough to have correction. And the gold kind of window is anywhere between 6 months and 2 years. That's the ideal time to correct it. The longer it goes ignored or not corrected, the more the secondary complications happen that are harder to treat.
Okay, so that's amazing that this procedure can actually, obviously depending on the carrier, whatever, the vet can be covered. If you get it right away before we even come see the vet, you already have the insurance in place. We come to see you, maybe not at 8 weeks you see, but it's not already pre-existing. So it can be covered that you can help your dog.
Health insurances cover this. This is a animal welfare issue.
Wow.
It's a breathing obstruction. They do cover it. It just, the problem is if you've had this dog who's had symptoms of a problem and then you wait to get the insurance, then they're going to say, sorry, the symptoms were there.
Yeah.
So even if you get it at 8 weeks, a lot of times there's no signs or symptoms of it at that time. And 2 months later you come in, then you'll be covered. But if there are signs or symptoms, regardless of the disease or whatever the problem is, the insurance will call it pre-existing. That's, the whole pet industry is like that as far as pet health insurance.
Right. So everybody hear that out there. this is covered. This procedure, if it's not a pre-existing condition, it will cover under insurance, which I think is huge, because I know a lot of, which we're going to get into the cost and all that. If it's not, a lot of these procedures sometimes is a lot of money for people. So the fact that you don't have to worry about that, I think is like, especially if you're thinking of getting one of these breeds that have these issues. I know, veterinarians that we spoke to before, of course, I always forget to show my watch off. One of their big things was pet insurance, to actually make sure that they get pet insurance. So I think that's number one too. So you said that you didn't create, which your name is Dr. Boaz Man, and the procedure is called the Boaz, right? Procedure?
The condition is the brachycephalic obstructive airway syndrome, is BOAS.
And you're BOAZ.
And yes. So I happen to be one letter off with my first name, which was coincidental, I believe. I'm happy to be, associated with helping these dogs in any way I can.
Yeah. So you said you helped improve this. And I know you do, if you can go, how you did improve this, kind of what it entails, because I don't think, people know. Let's start with that. What is this procedure exactly, and how is it improved since what everyone's doing now or was doing before?
Great question. So the two primary correctable conditions that we see are the nose being very, very narrow and closed, which is called stenotic nares. And in the throat, also, there is something called an elongated soft palate. The soft palate is the fleshy part that sits on top of the back of the throat. And it's only supposed to be, it's short. It's supposed to be short enough to allow them to breathe. So what that means is there shouldn't be a flap in the back of your dog's throat that's obstructing the entrance to the windpipe, to the trachea. And in these dogs, there's a flap, and that flap is called the elongated soft palate, and it sits right in front of the entrance to the windpipe. And so when they try to breathe, not only is their trachea smaller than other dogs, but then they have this big flap of tissue that's sitting in front of it, which is creating an airway obstruction that actually gets sucked into their trachea as they try to breathe. And one of the reasons that veterinarians and pet parents are always so nervous about these dogs going under anesthesia is because it becomes harder to even get an endotracheal tube in them, because you want to have an open airway, but you have to get this big flap out of the way in order to do that, and you don't see it very easily. So, that and a number of things, and unfortunately, in the past were ignored, and these jokes about the snoring, these jokes about, it's supposed to happen, they're not appropriate, and they're actually, pushing these, deprioritizing how important it is to get intervention early.
Yeah, people think it's a joke. Same, right? My dog snores so loud, and I think if they knew how serious, which is why I wanted to speak with you about this. So I bring in my dog. Tell me what I'm getting the procedure, right? We're getting the procedure. Tell me what it looks like. Do they have to stay overnight? How invasive is it? I know it's done with the laser, correct? So you're not having to jam a tube or anything down there. What does that look like, the whole procedure? How long am I there? Kind of
Great
walk
questions.
me through that.
Yeah. So one of the concerns, again, with pet parents and vets was the complications that used to be associated with these procedures, or the risks, I should say, because the standard of care in the past, and this was many years ago, and is still being performed in other hospitals, is to remove the tissue in the throat with something like a scalpel blade, cold steel, suturing in there in that area, bleeding and swelling that can happen, sutures in the back of the throat that can cause irritation, that required a lot of post-operative watch, post-operative care, ER intervention, 24-hour nursing, just to make sure that they don't have a complication. So when I say improve the procedure, I've been a laser surgeon for 20 years. But I learned how to do this without needing sutures by using the laser. And the benefits of the laser help to eliminate the need for sutures, to reduce any kind of trauma to the soft tissue that we're working with. So when we use the laser to make a cut, we are sealing the blood vessels, we're sealing the lymphatics, so there's less swelling, less bleeding, and we can see better in the airway, which is really important. And, if we have bleeding in the throat or in the airway, it becomes more of a problem than bleeding, let's say, when you're removing a lump on the skin, because you don't want blood going into the airway. That's obviously a much more difficult situation to deal with. Unfortunately, the other problem we had with these dogs is that we would wait and see until they got older if they really needed it. And by that time, the things behind the soft palate, like the larynx, would collapse. And once you have laryngeal collapse, there's different stages of it, but it is much more difficult to treat. And unfortunately, those older dogs ended up needing to have it bypassed and having a tube inserted into their trachea directly. So a tracheostomy or a tracheotomy, which can either be a temporary or a permanent need, where these dogs can't even go swimming because now they have a hole in their trachea. It's a big problem. So those are the kind of things that scared people away from it in the past. But now with the laser, we're able to do this as an outpatient procedure. We can remove a lot of the excessive tissue in the nose without suturing, without the bleeding. So it's really an advantage to the surgeon. We can see inside the nose. We can remove this tissue in the nose. They don't have to wear anything around their face because there's no sutures. They're going to pop out. So it's really a much different and in general, as long as they're the appropriate candidate, because you said to me, okay, well, I'm having it done for my dog. Mm-hmm. The first step is just like with any other thing. If you have a problem, you got to make sure your dog is a good candidate. So we do a number of different tests. There's even a grading system to see if they're good candidates. So there's a lot of things that we've improved. And it's been over the last 10 years, there have been about 300 studies on this versus before that, very limited.
Wow.
So we've gone a long way and improved things a lot.
I feel like it's an issue that people should pay attention to, or at least, like you said, do these tests, kind of see what is going on if your dog can be helped, instead of, I mean, for years, like, oh, he snores so loud, I can't even sleep in the same. It's just like with people, right? Like my husband will snore sometimes. I can kind of give him a little side nudge, where these dogs, it's like, and I can say to him, are you having trouble breathing? Like, I think you should get it tested. Whereas these animals, they can't like walk to the doctor themselves. So I think it's super important you bringing light to this and how serious it is, to be able for people to kind of at least get it checked, at least see if you can help your animal, with this.
You mentioned something great. I thought about the sleep situation. Because if you think about, you mentioned about your husband and other people that suffer from sleep apnea, these dogs are no different. They can't sleep. They end up having fatigue. They come in tired, almost looking like we gave them drugs, because they haven't been sleeping well for months and years. Wow. Some of them end up learning to prop their head up onto a couch, or even have a toy in their mouth while they're breathing, while they're sleeping, to facilitate opening their airway. They learn that, hey, I sleep better with this toy in my mouth.
Wow.
So it's not a joke. And these poor dogs, they suffer because they're just oxygen deprived. Yep. And we have such highly specialized sleep clinics for people that can't sleep. And so in this breed particular, it's very reminiscent to that. About not being able to sleep. It's important for them to be able to not only sleep, but when they go for a walk out here in South Florida, they can't regulate their body temperature, thermal regulation, because they can't breathe well through their nose or their mouth. And the reason they're doing this is because they have to breathe through their mouth, because they don't have the ability to breathe through their nose. So
crazy.
Yeah, there's some things we can't correct. Like, for example, most of them have tongues that are way too big for their mouths. So that's called macroglossia. That's never going to be corrected. You're not going to start changing the size of their tongue. But, there are certain things like this that can make a big difference and benefit to their ability to thrive.
So I know you're passionate about this, and, thank you because even just this talk brings to light so much for me that I didn't even know. I know you're passionate about it, and you do train. Where are you at? So obviously people can get this procedure done with you. I know you're teaching other veterinarians, or what is that? Are you trying to, what does that look like in the rest of the veterinarian world?
So I've partnered with a laser company, which is called VetScalpel, to help, because I do a lot of educational content. And I think that's one of the reasons that you and I, see eye to eye, because it's so important, not only for us who are experts to understand things like training or behavioral issues or medical issues, but it's important in our ethical responsibility to share that to as many people as possible. So we got to put this stuff out there. And in doing that, I was able to connect with VetScalpel. And then we decided, hey, this is a huge benefit for these pets. Let's train as many vets in general practice to feel comfortable with it. Because as you noticed, even I said I was a laser surgeon for so many years. I wasn't doing this for 20 years. And once I realized how important it was to do this, and how well these dogs did, we have meetings every year where we talk about different things we can do with the laser surgery. This is the number one hot topic in the general practice, where we can help these dogs like we never could before. We have a system to stage them. We have a system of meds they need before and after. We have a system of doing this safely, learning to use the instrument in the right way. I mean, it's not a replacement to make you a better surgeon, but once you know how to use this, whether it's to remove a dog's lump, anything in surgery you can do with soft tissue, you're going to have a better time with these patients and their recovery.
I mean, that's amazing. So do you travel right now in the U.S.? Is it worldwide? How often, how quickly are we going to see this kind of be like the norm for veterinarians?
It can't happen soon enough because there's so many pets that are still going under the radar.
Yeah.
I just came back from the West Indies Veterinary Conference. It was in St. Kitts. We did 3 talks. I do talks every year. There's something called, as far as a laser surgery symposium, we do it every year, a veterinary laser surgery symposium in different states in the U.S., because the vets who either had an old laser, they want to upgrade to the new laser, or just want to get exposed to it and learn, the benefits to using it in their practice, because it helps the vets, provide better care, separate themselves from other vets who don't have experience with using laser. And of course, this procedure itself, it's the ideal tool to help these dogs.
Yeah, I mean, thank you for what you do. I think it's amazing. Can I just say, too, I'm going to have Dr. Man where you can find him, but if you have an okay stomach, his TikToks and Instagrams and the videos that he posts, you guys would die if you see these videos, these poor animals, what he's like lasering off and taking out, that you're like, how was my dog even alive and breathing? So where can everybody find you? And I would encourage you, because once you see the social media, for me, okay, a dog snores, you're going to do this laser thing. Once you see it, you're like, holy, like, it's crazy. So where can people find you? Obviously, plug your veterinarian office too. What's the best way that they can reach you, find you on social media and everywhere else?
So Boca Midtown Vet, and town is like the old town spelling, N-E, is on Instagram, Boca Midtown. So BOCAMIDTOWNEVET on Instagram and TikTok. Also, if you go to our YouTube channel for Boca Midtown Animal Hospital, I have a lot of before and after cases. So if you put in Boaz laser surgery, you'll find all our videos.
Okay.
But to me, I agree. I still can't believe when I see these before and afters of these dogs that are going in and then leaving, breathing freely. I call them version 2.0 because it's hard to understand that it's the same dog who walked into my clinic who's now leaving and living and breathing better.
I mean, the videos are crazy.
There's nothing that I've ever done in my 20 years as being a vet that's more rewarding for everybody, not for just the veterinarian to see the improvement, but for the pet parent to see it, for them to be able to walk the dog for longer, for them to be able to recover sooner. Mm-hmm. A lot of these dogs, also specifically the Frenchies, they regurgitate, which is associated with this problem because of the pressure. They have such pressure, it actually sucks parts of their esophagus up, and it creates these regurgitation issues, and it's not good for them, and a lot of them respond very favorably. The regurgitation improves. So there's so many benefits to helping these dogs.
Yeah, well, thank you again. Thank you. I know you're super busy taking the time. Please check out Boca Midtown Animal Hospital. You'll see everything on there. It's truly amazing. Even if you I don't have a Frenchie. I don't have a bulldog. I don't have a pug. Just watching these videos, even for myself or friends that have bulldogs, I'm like, hey, you need to really get this checked out. So thank you for listening, Barks to Basic. You can listen to us anywhere, podcast, Audible, Spotify, Apple Music, my social media, at Dynamite Dog Training, at Lucky Dog Training Club. You can find us everywhere. So thank you again, listening to Barks to Basics. We'll see you next time.